Hi, Dr. Nikki Gonzalez from Balance Physical Therapy, physical therapist as well as strength and conditioning specialist. I want to talk to you guys today a little bit about shoulder impingement, what it is, what could be causing it, and what tests you can do at home to see if you think you have it going on. So to start with, let's talk about what it is. So there's two types of impingement that we'll be talking about. The first is what we call subacromial impingement. So the top bone here in the shoulder is actually going to be abutting or rubbing into one of the muscles of the rotator cuff. That muscle in particular is the supraspinatus. So with motions like overhead or what we call abduction, which is a little bit out to the side, the supraspinatus is the primary mover of the rotator cuff for that motion to help lift the humerus. So for those of us who are dealing with subacromial impingement, the amount of space or clearance for that arm is decreased, and we get that pinching between that muscle, that supraspinatus, and the bone of the acromion. And the secondary impingement that we'll be talking about is more of a result of a displacement of the humerus and an instability. So most commonly we see a secondary impingement posterior in the back of the shoulder with folks that are doing things like overhead pressing, whether it be some of our functional fitness athletes, as well as a lot of times with our throwers or swimmers. So if you consider the naturally unstable position of being in this 90-90 up here, and then the velocities, especially with something like overhead throwing or volleyball or swimming, that repetitive stress in the humerus can lead to increased movement and shearing and impingement of those posterior rotator cuff muscles. The first test that I'd like for you to try performing on yourself at home is by lifting your arm up to about shoulder height and then bringing it down like so, and then with your other hand pushing down to the ground through your wrist. Now if you feel an increased pain in the front of the shoulder, this might be a positive test. A second test that you can do is to lift your arm up about shoulder height, maybe a little higher, with your thumb up towards the ceiling. And then try again with the thumb down to the floor. Similarly, if you feel an increased symptom in the front of your shoulder or on top, this could also be a positive test. And the third test is to just do an arc of motion overhead. And if you feel symptoms from about approximately 60 degrees to about 120 degrees in this motion here, that could also be a positive test. If you found any of this information particularly useful, please check us out on our Instagram at BalancePTMove or our website at balancept.com. Thank you.